Yes, good morning, ladies and gentlemen. I just want to talk about one of the initiatives that have started over the past few years. As Dr. Surju Singh had mentioned, coming out of the Maternity Services Review Committee report, there were certain recommendations, including the start of the Directorate of Women's Health. One of these initiatives is the SIP, which is a perinatal information system, which is a new clinical record that has now replaced the old record that is used for obstetric care in Trinidad and Tobago. This record is now being used in all the RHAs, and the advantage with this record is that it standardizes, or it aims to standardize the care provided to women by ensuring that every woman has certain basic investigations being done. Another benefit of this record is that there's a built-in data analysis. It is a tool that allows us to collect data and analyze data so that you can monitor trends in care. And this information can be passed up to the administrators of those responsible for providing care to women. Of note, earlier this year, we had an advanced form of this perinatal record, SIP+. What that means is that the perinatal information record is now available online. In each RHA, there is, on its server, the record is available on the server where the patient information is entered. Now, certain select persons have access to this information by password so that it is secure access. The access is only to those persons caring for the woman. The advantage with it, whereas before we had to rely on paper records, finding the patient's notes, when all these patients' files are entered on the server, the doctor or the nurse will have access to the patient record immediately, which is a big improvement from what we had before. It is still being rolled out, but that is the aim of this. The other aim of this is that with having patients' record online, you can immediately, with a click of a button, notice trends in care of the pregnant woman in your area. Basically, the obstetrics service, or the providers of obstetric care, we have now entered the digital world. And this, I should say, is thanks to the efforts of the Directorate of Women's Health, led by Dr. Surju Singh. We had lots of support from PAHO, and we have Ms. Garsoy here. The Ministry of Health, even though it's in Tobago, the Ministry of Health provides a lot of support to the RHA in Tobago and the THA in its mandate for providing care to not just the public at large, but women specifically. I thank you.